All right, so welcome, and we are excited just to jump on in and provide you with an update on our COVID-19 testing program, as well as key updates on our protocols, as well as sharing with you some valuable resources today, particularly around contact tracing. So as always, just want to remind you who's involved. Lots of us involved in the project, but several of us who you are going to interact with the most. Particularly from DESE, from the Shaw Foundation, from the COVID-19 Command Center, and feel free to reach out to any of us to get the support that you need to implement this important program. So like I said, for today, we want to just start by beginning at the sort of really important information right out of the gate here at the beginning to really support contact tracing. And we're really pleased to be joined by Dr. Andrea Ciarinello from the Massachusetts General Hospital to talk to us about a great resource to support contact tracing, because we know that that's a time taker and we want to do it efficiently and effectively. We'll then talk about some further information about eMed at-home tests. Then I'll take us through some of the most recent FAQs and protocol related documents that DESE has released, some as recently as just this past Monday, and then do a final touchdown around the Shaw Family Foundation resources that we hope you will access and continue to use. So that's our agenda for today. Let's just continue to dive right in. And like I said, I'm so pleased that we're joined by Dr. Ciarinello, who's an infectious disease doctor at MGH. And really glad, Dr. Ciarinello, for you just to jump right in. Lauren?
Can you hear me?
Nope.
Okay, I'm gonna put it in the chat.
Okay.
Can you hear me?
All right. Andrea, I hope you're able to come on video, come off of mute. I'm not sure about the technical issues we're having today, but
can you hear me?
Andrea, yeah, we can hear you. I don't
Okay.
think Russell is able to hear anybody.
Okay, and you probably can't see me, but that's probably fine.
I can't hear anything.
Oh.
Lauren, can you?
Yes, yes.
Oh, so it's me. Oh, I know what it is. Super awkward. All right, bear with me.
Go ahead, Andrea.
I figured it out. It's gonna take me 1 second.
I can present maybe while Russell is sorting out his audio. So thank you so much for the chance to share this information. Our team at MGH has been working for the past 18 months or so with a number of school districts as they consider the safest ways to support in-person education. And we know that every district has gone to incredible lengths, not only to put those mitigation measures in place, but also to really keep track of how well they were working, including kind of keeping track of every student and staff member who was diagnosed with COVID and testing and tracing their contacts and keeping track of their outcomes. And we were really grateful that 8 districts were willing to go through all these data and share them with us during a very short turnaround time period over the summer. And be able to learn some really important lessons from those data. Some of them are highlighted here, and I'll share some of those findings in just a second. But as we were doing that, many of the district teams mentioned that it would have been helpful to have the data collection form available for their regular day-to-day use all year. And they had really great suggestions on how to improve it for this coming year. So we put together a revised version of the spreadsheet that we used, and we really just wanted to make it available to all the districts in Massachusetts who might want to use it. And there are kind of 2 reasons why we thought people might want to use it. One is that we hope it will be useful for your kind of day-to-day record keeping in keeping track of cases and contacts, and including people who are using the Test to Stay program. Oh, great, thanks, there it is. The other is, there's definitely no obligation to share any of the data that are collected using this spreadsheet. But if your district would be willing to be part of the research study, then collecting the data in this format will just make it very easy to share it at a few key time points during the year. So there wouldn't have to be any new data entry or copying and pasting. We're happy that all of the 8 districts who did this the first time around are going to continue participating, and we would definitely love others to join. And this is an IRB approved research protocol. And so you would just delete, if you add any information, any columns, for example, with identifying information, you would just delete that information before sharing this with us. So Russell is showing you the spreadsheet right there. And this is we have a dated version on it because we probably will need to push out some updates during the course of the year. But basically for each index case, this is a way to track certain information, student or staff, the date, the reason they were tested, how long they were in school during their infectious period, vaccination status, and then the number of in-school contacts identified for that index case. And then each of those contacts then has their own line, which you can see here beginning on row 441. And Lauren, if you can scroll a little bit more over to the right. Thanks. And I don't know if we want to spend time going through this in detail. We're happy to walk through it, individually with people if they want to use it, but it asks questions about dates of exposure, their role, the location of the contact, the nature of the contact, things like masking and distancing. If you could scroll a little more to the right, there are places to record the vaccination status of the contact, and then a little bit further to the right, the results of quarantining and testing. So what quarantine strategy the contact chose to use, did they do test and stay, if they had any of these kind of tests done, what the results were. And then at the far right, we have a little bit of information about whether the in-school contact tracing team felt that this was likely to be an in-school transmission or an out-of-school transmission. So I think it might be helpful to share some of the findings from this 8 districts who participated in this with data from last year. And I think some of those were highlighted on the slide that Russell shared. But basically, when someone with SARS-CoV-2 infection came into a school building or onto campus last year, in those 8 districts, the overall risk that they transmitted to anybody else was 2.2%. So this is very low, and it's consistent with data from other states in schools with the full mitigation measures that we have, masking, distancing, et cetera. We found some interesting factors that seem to increase the risk of transmission. For example, if both the person with COVID and the contact were unmasked, the risk of transmission was about 7-fold higher. We found that a number of the transmissions, about 15 of the 29 documented transmissions, were associated with some kind of difficulty following the recommended mitigation protocols. Interestingly, the only transmission that was observed at lunch was actually among staff. There was no lunch transmission observed among students, although the numbers were very small. And another really important risk factor was attending work or school while symptomatic. So kind of continuing to underscore this importance of making sure that people have support systems in place to really stay home if they're feeling sick. And so in the coming year, there's, I think, a lot of uncertainty about what this risk of in-school transmission will look like. On the one hand, we have so many students, staff, and parents who are vaccinated, which will decrease the risks. On the other hand, we're relaxing some of the mitigation measures that we had last year, and we don't have a lot of data yet about Delta in schools. So we think that continuing this study into the coming year will provide really important information in this changing landscape. And we'd love for as many districts who are interested to join this effort. We'd be delighted to include you on the study team in terms of participating in the analysis and write-up for anyone on your team who's interested too. So I think I'll stop there. We'd love it to be a resource as well. And please reach out to me or to Sandy Nelson, and we can share our contact information if people have any questions or there's anything we can do to help.
Thank you so much. And we're really excited about having this valuable resource available for districts. Lauren, you've put that in the chat so people can download it. And I just hope that it's a way just to organize the information and to get the right information, maybe take some of the guesswork out of the contact tracing for the new school year, and just, hopefully contribute to an important study that can just help us all know about the safety of our schools. So thank you again so much, Dr. Serno. Really appreciate your time today and appreciate this valuable resource that you all have so willingly taken on for us. Just gonna, pause really quickly before we go on with the presentation. We are capped at our participation today. And so I'm gonna ask anybody who, particularly our DESE staff or CIC staff, who could access a recording later. We really wanna make sure that the districts are able to get in. And so if we can consolidate participation, or if you are district staff and you're able to just join up with a peer, it will allow maybe more to get in. We're trying to get in right now. So I just see the number, right now at 502, just knowing that there are people who want to get in who can't. And so anything that people can do to help make room for others would be greatly appreciated. So thanks very much. Appreciate your attention to that. So let's go in a little further into the content and talk a little bit about the eMed at home tests, and particularly not only just who they should be used for, but also how to order them. So just starting with, we're excited about the ability to offer you eMed at home. So eMed at home is the Binex Now test that can just be used at home instead of in school. The results do go to DPH, so it is an administered test. When you have eMed, you have to log in, and a provider watches you conduct the test remotely, so that it's done the right way, and you're logging in your information so that it does go to DPH, so they find out who those positive results are. We envision it right now where, particularly individuals who are involved in test and stay during the week might hit the weekend, right? They're involved in an athletic event, they've got an extracurricular going on, they come to the weekend, and we just want to be as careful on the weekends for school-based events as we are during the weekdays. And so right now, what we want to see eMed used for is for those weekend events, those school-sponsored weekend events, to hopefully allow students to safely participate. So, you would be able to order and have on hand a small supply of eMed for right now to be able to use on the weekend, so that if an individual does appear negative, show negative, get negative results on eMed, they would be able to continue to participate in the weekend event, that Saturday or Sunday athletic event or extracurricular. And if they test positive, then they should be treated as a positive case and obviously not participate. We think this will be really useful to you. We do hope that in the future, we are able to offer this for other purposes, particularly emergency purposes, where you could have a little more discretion over how to use them. But based on the supply that we have right now of eMed, we're just going to need to keep this sort of, only available for these weekend events, just so we can kind of continue the test and stay protocol for those events only. Remember, though, that for all other students, when we come to a weekend or a holiday, the student would then just be tested immediately upon return to school if they're involved in test and stay. They don't need to be tested on the weekends. So it's really just those students who we want to offer safe in-person weekend events that are school sponsored. So the next question, I'm sure, is then how to order those tests. And CIC will be circulating a little later today a link to a survey where you can request those eMed tests. We have sort of, based on your population, created a kind of a fixed supply to start you off, but you can continue to order more tests as necessary. And those of you who were involved in Binex Now last year are familiar with the way in which we set up a hub within your district where we send all the Binex Now tests to. The same thing will happen with eMed. You will identify to us that single hub within the district, and that's where we will make sure that we deliver these resources to. And we do have a short FAQ related to eMed testing. Lauren is putting that in the chat as well, so that you can get right to what you need, because we know there might be some additional questions. Lauren, Jeremiah, I just want to pause real quick and see if I missed anything about eMed.
There were just a couple of questions in the chat, Russell, about a broader use of eMed. And at this time, we are only allowing for eMed to be used for the identified close contacts who are participating in test and stay, who are attending a non-school event, so something over the weekend or a non-school day event. And then otherwise, the traditional Binex Now should be used in school during school days.
Yeah, thanks, Lauren. I would just emphasize that. Thank you.
Great. Thanks to you both. Let's move on to talk about our FAQs and on our both testing and around the protocols. So just let's start with testing. We just recently published a very extensive FAQ on testing, and so we hope that I'll show it to you in a minute. Lauren will put the link in the chat. But we know that there are a lot of questions about what we call level 2 support, that on-site support that we know is very necessary and very valuable in order to launch this program. So a question that we just want to get right to the bottom of at the beginning here is around, when will you receive your support from CIC if you've requested these level 2 supports? So just for perspective's sake, we have over 530 applications from schools and districts. to begin this testing program. More than 2,000 schools, and the total enrollment in all of those schools is over 800,000 students. So it's a lot to do in a short amount of time, but we're really committed to doing it and getting this off the ground well. So the first order of business is that you will hear from CIC within 48 hours with a welcome email. And we've continued to work with CIC on this and really appreciate their problem solving on how to make sure that we get that message out. In some cases, if you didn't hear within 48 hours, it was because we were trying to couple the kind of matching the staffing solution, who would be coming on site, who is that level 2 support, with the welcome message. Going forward, if you've applied, we're just going to make sure we get that welcome message out right away so that you hear from us, so that you know that you're matched and connected, while we continue to work on getting that level 2 support contact for your school or district as well. So you'll be hearing within those 2 days. Just know that, during that time, what CIC is doing, just to be very transparent, is just working to make sure that they're matching you with available subcontractors who can provide that level 2 support. And so, we're just really working hard to make sure we get those supports in place. In some cases, rare cases, we might be delayed, but just know that we are working to overcome any problems so that we can make sure you get those supports as close to the beginning of the school year as possible. And if you are in a situation where you're kind of ready to begin, but you don't have the level 2 supports yet, there might be certain aspects of our testing program that you can implement because you'll have the supplies on hand. So you'll with By Now tests, you can begin testing symptomatic individuals. If you're able to use existing staff for that, you would be able to, again, just, thinking about what can you do in the meantime might be a way of looking at this as well. And it could be also a good time just to be working on increasing consent and working on family buy-in to this testing program as well. So we know there are a lot of questions about this, and so we just wanted to begin there. Bear with me, I'm going to stop sharing so that I can actually take you to the rest of the FAQ on testing, and then we'll go to protocols. So just bear with me for a second. And I need to just go to share my screen again. And I'm going to not share my screen just yet. Hold on, let me go to the right tab to get you there. Oh, good, I'm there. All right. And getting there. All right, here we are. Okay. So on August 24th, we put out an FAQ on our testing program. And there are a lot of questions here, right? You can see 8 pages. I'm not going to go over each and every one of them, but I'm going to make sure that I call out a few that are particularly relevant now. So we've just been hearing questions about can districts and schools mandate COVID testing? And so very germane to public schools in particular, that you need to make sure that you keep participation as being optional, that you've signed an assurance statement with us that says that it will be voluntary. And so really, this is what we want for all of our schools and districts, is to make sure that it is, if you're part of our program, that it is a voluntary process. And so we want to make sure that parents have the option of signing up, not that they would be required to do so. The next area that we know we've gotten a lot of concerns about and questions about is about By Now. And we want to make sure that we know kind of how will you receive them, how will you get them. Last year, keep in mind, you ordered them through us. And what we want to make sure that you know is that you are now ordering them through CIC. And if you are able to use what you have on hand, the supply that you have on hand, we certainly encourage you to do so. And then again, work with CIC to get more of what you need. Jeremiah, do you want to just voice over a little bit more there around anything else that we've been hearing about By Now and receiving those tests?
Sure. Yeah. Thank you, Russell. I think 3 things. The first one is, you said this, Russell, and I just want to highlight it for folks, that you do still have to order these. So no one's, well, actually, we're working to try to make sure that in cases where we know you don't have any, we're trying to get you some right now. But CIC did send you a form. If you need some of these tests, and you should need them for symptomatic or test and stay, and in certain pooled testing models, you will need them. So please pay attention to that form. And if you don't have these tests and you think you might need them, ask your program coordinator from CIC. And if you don't have these tests and you know you need them, then please fill out the form. The second thing is just around the expiration dates here. So I know that the expiration dates that are printed on the tests I believe that they're actually all past those printed expiration dates. And this is just because the FDA had no idea how long these tests would be good. And as they continue to exist in the world and the FDA continues to do research on tests that were made, I guess at this point, about a year ago, we found that they're good for longer and longer. So there is an extension sheet that we'd be happy to send you, or CIC certainly has on file, DPH has it on file. But I don't believe that there's a single case of actually expired Binax kits out at a school today. So if you think that yours are expired, then just check in. We can send you the letter and you can check your lot numbers against that. The last thing, sorry, folks, who knows? If I get the last thing, Russell, I'll drop it in the chat to you and maybe we can circle back and maybe somebody will ask.
Chairman, I wonder if we just want to talk about the delivery dates.
Yeah, that was the third thing. Thank you, Russell. So thank you very much. Right now, we're seeing delivery dates in line with what we had released in our guidance both last year and this year, which is within 7 calendar days. As you can imagine, with 2,000 schools and 800,000 students, the warehouse over at DPH has their hands full. So we're still falling within that estimate, but we certainly gotten to a point in the spring where we were getting these fulfilled, within sometimes 24 hours or 48 hours. And unfortunately, we're looking at fulfillment times longer than that. As they told us this morning, they're not Amazon, but they're doing their best. If you are looking at an order time that's longer than that, so if you placed an order more than a week ago and you don't have them, we'd love to hear from you. We can troubleshoot on a one-on-one basis. If you have a real situation and you have positives within the building, you do not have tests on hand, please reach out to the K-12 testing email and we can try to work with CIC to just get you the closest store, whether it's driving over tests from a different district or whatever it is. We can just do our best to make sure that we can get your needs met.
And there's already been some great problem solving here at the beginning of the school year to get tests on site in a rapid way so that people aren't just sort of feeling like they're caught waiting for a supply that they don't have. But like Jeremiah said, just order through CIC and we'll get them to you as quickly as we can. And if you're really in a bind, just please email us so that at our K-12 testing email so that we help to get good problem solving for you to make sure you get what you need. We've already talked about eMed and how to use it. So just again, eMed right now being available for continuing test and stay into the weekend for students who are involved in athletic or extracurricular events on non-school days. Just moving on real quick. The additional services that we already talked a little bit about requesting those additional services and that we're working to kind of, mobilize on them as quickly as we can and coordinating with CIC. So I think that the slide that we had was actually the most descriptive on this. So probably not a lot more to add right there. Going down to just again, standing orders. Last year you had for Binax Now, you had to get your own standing order. This year, just to underscore that CIC is providing the standing order. This is particularly relevant to private schools. And so just want to make sure that we're heading that one off at the pass as we're getting a lot of those questions. Just moving to consent. We've had a lot of questions about how you acquire consent. And again, just really emphasizing to acquire consent electronically and trying to include the consent form with as much back to school materials as possible. We do have the translated versions available on our DESE website with a link in the FAQ as well. Just going on a little bit further, if you did have consent last year, you do need to make sure you get it again this year. And that we really want to ask for consent for all components of our testing program. We know that's been a question. Is there a way for parents to only consent to part of the testing? Because right now they would be consenting to all 3 parts. And we talked about that since August about that this is coming, that this is how it is set up in the system, that we're asking for parents to consent to all 3. We haven't changed that. That is still the message for right now. We're looking into it because we are hearing, a lot of questions and concerns. And anytime we hear a lot of concerns, we do continue to follow up. But for right now, we just ask that you continue to reiterate to parents that the school will be transparent about which testing program they're offering. So while the parent consents to all three, if it's not being offered, it's not going to happen. So if you're not doing, for example, pooled testing, but you are doing symptomatic and test and stay, if you're not offering it, it's not going to happen. And the parent hopefully can, just feel that confidence knowing what the district is offering and maybe what it's not. As well as, when we come around to do testing, when the staff, are conducting, for example, the routine COVID safety checks in our school, students would not be, they don't have to participate. So if a student doesn't come out in the hall to have their nose swabbed, that's acceptable as well. And so whatever messaging helps with your families, but we just want to make sure that, for right now, we are asking for all three because we don't know that we might not need to kind of add another layer to testing. Maybe you're right now signed up for, again, maybe symptomatic and test and stay, and you chose as a school or district not to do routine COVID safety checks. Maybe you will later in the year. And so just having that consent on file now will just help you pivot, because COVID has really asked us to pivot a lot. And so hopefully sharing that message with your families will be useful to make sure that we get them what they need. And again, every time that will help you so that you don't have to ask for consent again every time you add a new component. We know that last year you had to go out for consent several times, just as we made adjustments. Our goal for this year was to try to cut down on the number of times that we have to go to parents for consent. And so I can't guarantee we won't have to, for some reason, go back out again, but by and large, we're trying to make it so that you consent once and we're free and clear for the school year to, just make sure that we support our students with the kind of rapidly changing COVID environment. Lauren, Jeremiah, anything else? I guess just one other quick thing is that there can't be sort of an automatic opt-out, like all students aren't automatically consented for and parents would have to opt out. There does have to be an affirmative active consent to testing. I think about it like we ask for consent every year for parents to take pictures of kids in schools, for that media release that you ask for every year. So same sort of thing with this, we just need to ask every year for consent. But again, Lauren, Jeremiah, anything I missed regarding consent?
Nothing regarding consent, Russell, but is one big question about the clarification for the who can be part of the test and stay program, but I'm not sure if we're getting to that.
Yeah, I will be getting to that in just a minute, actually. So
Great.
We'll definitely get there. All right, so that's it for the Q&A that I just wanted to make sure that you had a chance to go through and just hopefully use as a resource. So if you kind of know that these questions are answered in this document, hopefully that will be useful to you. Let's switch over to protocols now. And just want to start by sharing with you the protocols document that we have been able to share with you just this week. And I hope that I'll just start at the beginning, that this document is something that is useful to you as sort of an additional resource to the main protocols document. So this document isn't meant to replace the main protocols document, because that main protocols document, the one that we released in August, really has all the detail in it. And so we just always ask you to use these side by side, that, this gives you that kind of like bird's eye view, that kind of high level overview of the protocols, puts it in a graphic format that might be kind of, hopefully just more at a glance information. But we know there are a lot of details to the protocols, and the details really matter because safety matters. And so, coupling the two together will make sure that you get the information you need. And when in doubt, when you feel like you get that deeper level of question, please review the whole protocols document, including the questions and answers that we included at the end, because particularly that differentiation around vaccinated individuals with mild symptoms, things like that, where it gets really kind of complicated and you have to hold a lot of variables in your head. Just please look at our full document to get those answers that you need. But let's just orient ourselves to this document really quickly. As a former elementary teacher, we're going to use some good elementary nonfiction reading strategies here. So, you can see the kind of graphical way that it's presented. We know already from reviewing the protocols document that there's protocol A, B, and C. So you can see that it's organized that way: protocol A, protocol B, protocol C, each one on one page. So again, hopefully that just gives you that kind of mental schema for what we're going to be looking at here. And then just notice over here on the right side, the legend. Any cloud that we see in blue means stay in school. Anytime we see that orange, that peach cloud, that means go home. And so again, we're just going to use this legend. We're going to use our orientation to this document to help us sort of read it, ascertain it, understand it. Protocol A, very straightforward: test positive for COVID. You need to go home. So we're using our key, our legend, to know that this, anytime we see peach, it means go home. And bringing over some of the important information from the protocols document about when you can return to school. So I'm not going to go through this in depth because I think we're all pretty used to what to do for COVID positive individuals. But let's look a little more closely at close contacts who are asymptomatic. And this is where, I think that the attention really needs to be, particularly when we get into test and stay. So if you are a close contact and you're asymptomatic, right, here are the exemptions in a nice little box, because we've gotten lots of questions about the exemptions. And we begin to follow the flow chart. So first of all, are you a close contact and you're exempt? You can remain in school because you are asymptomatic, always underscoring. You're asymptomatic, you're exempted, you can remain in school. Does your school offer test and stay? If yes, then we come over here and start going through the test and stay protocol, because again, you're asymptomatic, but you're a close contact, and we have test and stay. Please notice that we've got this as a recommended option. Let's just pause and talk a little bit more about test and stay, because like you said, Lauren, there are a lot of questions coming in about why can't test and stay be used for individuals who are identified as close contacts outside of school. And so right now, we're really holding firm on our position that, in other cases, close contacts would need to quarantine. But if you are exposed in school, the likelihood that that exposure is going to lead to infection is greatly reduced, or more or less likely than it would be in, for example, a home situation, because a school is a more managed environment. There are other safety protocols in place. For example, you don't come to school if you're feeling sick, right? But if you're home, you're more likely, if someone is sick, they're closer to you, right? Even though we ask for somebody who's sick, somebody who's symptomatic, to try to isolate within the home, that's hard, that's challenging. And so that difference between an exposure in the home to somebody who has symptoms or to somebody who actually has COVID, right? The likelihood that you're going to become positive is much greater than in a school where right now we're all wearing masks, where we know to stay home if we're sick. We're employing the hand washing. We've got other mitigation strategies like routine COVID safety checks in place. It's just a much more managed environment. And so, we're assuming some risk here, right? We're saying instead of having the individual go home and quarantine, we are assuming a little bit of risk here and saying that individual could actually stay in our school and just have this regular testing each day through test and stay to remain in school. And so we want to make sure that we assume that risk where it makes the most sense to do so, that we're not kind of broadening that risk to a point where we really could have, outbreaks that would be very unfortunate, would lead to further consequences related to illness, related to missed school. And so, where we're taking on a different protocol, right, to allow students to stay in school, students and staff to stay in school, and just have this regular testing, is to say it's based on the assumption that the exposure was in school, where it's less likely to lead to a positive result. So again, we know we're getting a lot of questions on that. We hope that that explanation is at least somewhat helpful to you, as I know that people are coming at you and saying, but why can't my child who was, exposed maybe at a dance studio or, at flag football, why can't they, be involved in test and stay? And right now the answer is no. The answer is, this is really about exposures in school, because schools are very much managed environments. And we just know that there just hasn't been as much, like Andrea said at the beginning of our meeting today, just hasn't been as much transmission in schools. That's good news. And we want to build on that good news with our test and stay protocol. So again, hope that answers that question. Just remembering then that this is our recommended option. If we don't have test and stay and someone is a close contact in school, so the answer being no, we don't have test and stay, you've got to figure out which option you're following. The traditional protocol, which is to get that COVID test after 5 days, 5 days or later after exposure, being able to return to school on day 8, and then our less recommended provision of staying out of school and returning on day 11. And again, less recommended because we just want students back in school safely if they get that test on day 5 or later. So again, I hope that this is helpful. It could be something that, again, you maybe print, you could laminate just so that you have it at a glance, because there's a lot to keep track of, but always using our full protocols document as backup. And then finally, when we have symptomatic individuals, again, just trying to have this in a kind of graphical way for you to be able to follow. If the individual is experiencing symptoms, what might lead them to need to go home, right? That positive result on a Binax Now test in school, or if it's negative, being able to return to class, depending on the combination, particularly these mild symptoms, allowing you to be able to stay. So we hope that this is useful to you. We're glad to answer questions that you might have. Lauren, anything popping up in the chat particularly relevant to this before I go on to the final document with the group?
No, I would just reiterate your point, Russell, that this flowcharts document is intended to be used alongside the full protocols document. This flowchart is supposed to be a quick, easy user guide, but certainly additional details and the nuances of each protocol are listed in the full protocols document. So they really should be used in tandem and side by side with one another to get the full detail of the protocol.
Yep, great, thanks so much. So the final thing that I just wanted to share today before we go to your questions is just our the FAQ that we put out on August 20th. Which was really not just the other FAQ that I showed you was solely about testing. This one was more in response to our protocols document and the health and safety guidance that we've been putting out. And one of the key things that we included in this is the provision that if a student does need to go home, right, they need to quarantine, either as a close contact or because they've been identified as positively having COVID, that they can participate in remote learning if they're able to follow their same schedule remotely as they would do when they're in school. And this is different. Remember the last time that I came to you earlier in August, I said this was not possible. Again, we heard your questions, we heard your concerns. COVID requires us to adjust. COVID requires us to adapt. And so we did add this provision, particularly where the last time I was with you, I publicly and verbally said that this was not available. Just wanted to make sure that you saw this update, that you saw this evolution in our thinking, and that you're able to consider implementing it if at all possible, just to keep students as actively engaged in their learning as we can. And so really with that in mind, Lauren, I would love to go to people's questions. I will stop sharing. Those were the documents that I wanted to review. Oh, no, sorry. I need to go back to the PowerPoint, which I have right here. I'm not going to put it in presentation mode. I know that this is going to be a little bit small, but I did want to just reiterate the resources that the Shaw Foundation is able to offer. So really, I know you can't see the content that's on this slide, but what I want to just reiterate to you is that at the COVID Ed testing website, our colleagues at the Shaw Foundation continue to update really important and useful resources for you related to things like consent and communications. What are creative, inventive ways of communicating with families and sharing with them the importance of signing up for COVID testing in our schools. Case studies that we hope are just useful to you. We don't have to reinvent the wheel. Maybe by reviewing a case study, you'll find some tips, some strategies that will help you implement testing more efficiently in your schools. And then they're getting started guides as well. So these, kind of a 101 overview, their communications guides, their examples, their templates, just encouraging you to take a look there. They do continually update their website so that, it has the most recent information for you. So please take a look there so that you get what you need in order to just, again, not have to reinvent the wheel, learn from your colleagues, learn from each other across the state. That's what Shaw's doing. They're just hearing great examples, good stories, great resources, and just making them publicly available for all of you. So if you have a minute, just please take a look. Quickly on next steps, again, if you haven't already signed up, please do so by completing our application, and the link is included there. And then just a reminder that if needed, request your eMed at-home tests or your BinaxNOW Now tests through the forms provided by CIC. We talked about that a little bit at the beginning, so I'm not going to go over all the sub-bullets there, but just that reminder around using and accessing BinaxNOW Now as well. So Lauren, now I'll stop the share and glad to see what's on people's minds.
Sure, Russell. I think a review of that policy for students who need to quarantine and remote learning.
Great. So if a student is able to follow their same schedule when they're at home, so you're able to kind of set up, for example, live streaming so that they can still access their classes, their schedule while they're in quarantine or when they're isolating, that is allowable. That would count as school time as long as they're able to meet the standard attendance requirement, again, which is, for all of us, for all students, that they would be able to participate in school for the, a day of attendance is at least a half day of school, right? That the student is in school for at least half the day means that you could count them as being in attendance. And so, that's the minimum on a daily basis. But what we want to make sure is that if they are in quarantine, if they are isolating, that they could participate in the full school day remotely. And if yes, then that would not need to count as absences. If what I had said before still holds true, though, if you can't offer that simultaneous remote virtual option for students, then that would need to count as an absence. You could still send work home, work to keep the student active in their learning, but the time would not count towards attendance because they wouldn't be in school. It's all the more reason why we feel very passionately about getting Test and Stay going, so that we just keep our students in school as best we can and have as little quarantining as possible.
Great. Lots of questions about where we can find the documents, and I'm going to put all the links in the chat again so that everyone has them. There's a question, Russell, about so people know they cannot mandate testing for in-school access, but wondering if it can be mandated for extracurriculars or sports.
It's a good question. Where we come down on this is that where our requirements are around student learning, structured learning time. So you have to make sure that you're providing structured learning time for students. And so anything that interferes, like if a student didn't consent, right, and they couldn't access school, that's a problem. Not being able to access learning in the school day is a problem. So it's always that, what's the consequence, right? If you require it for your, let's just say your athletes, for extracurriculars, what would the final consequence be? Would they be kept out of school? If so, then that's a definite no from us. It's still a little bit, it's hard for us to advise you on all the aspects of, civil rights outside of, what DESE controls around access to things like extracurriculars and sports. But what we're very clear on is the student has to have access to structured learning time. And so anything that would prevent them from that, that's where it is very clear would be a problem.
Great. Wondering, there's some questions about the obligation to notify individuals about close contacts and whether or not districts need to notify families.
Yeah, so we do advise that you notify families. That was a practice that you were in last year, and we would definitely recommend that again this year. Your child has been identified as a close contact, and they will, but because you've consented, they'll participate in Test and Stay. We think would be important. Also because, the families need to know that the child is a close contact. There's a risk of infection, and our advice is that the student doesn't participate in after-school activities while they're involved in Test and Stay until they get past that period of time that we say that they are no longer, otherwise would need to, the same period of time, right, that they're in Test and Stay would be a quarantine period. And so we need to think about that as we want to make sure that they are still coming to school and still learning, but really limiting and eliminating those extracurricular outside of school activities, just to really cut down on any potential risk of further exposure for others. So I think that's really important to note. And then just along with that, I know there are questions about who can participate in test and stay, and that's definitely available for staff and students, because we want to keep our teachers in school safely as well. And so I think that's important to note too.
Great. And Russell, there are some people wondering if they need to, or actually Jeremiah, maybe you can jump in and answer this, wondering about if they filled out the CLIA last year, do they need to resubmit for a CLIA this year?
Thanks, Lauren. No, they don't. So if you did this for every school that's going to be testing in the fall, you do not need to go back and submit it for any school that was testing in the spring again.
Great. And then Russell, questions about should fully vaccinated individuals participate in routine COVID testing?
Yeah, so our message right now is that they may. What we've written is that it's not recommended, but I think it's fine for you to really, to communicate that as, you may participate. And really the way that we think about it is we want to prioritize the unvaccinated, but we really leave that up to you to decide how best to message that to you, your staff. Our word on this is that they may, but we really want to prioritize the unvaccinated. Maybe it's not an issue of prioritization, and we want to just keep our schools as safe as possible. So just knowing that it is possible to do it, and not our first highest level of recommendation, but that it is possible as well.
Great. And then there are some questions about if an individual or a student is participating in the test and stay and is currently identified and is in the process of being tested, can they attend after school extracurricular activities?
So our recommendation is that they don't. We would appreciate you telling families that the student has been identified as a close contact. They can still come to school, because in school, it's again a more managed environment. And again, we have a lot of the safety protocols in place, the mitigation protocols in place, and so we really want to preserve learning time for students. But unfortunately, being identified as a close contact comes with responsibilities to yourself, to your family, to your community, and we ask that students not participate in out-of-school activities. Maybe those activities that they might do not associated with the school. And we know that's a hardship. We know that's a burden, but again, we have to take that attitude that we're in this together. Well, and I also just want to take a minute to just give a quick word about close contacts. We really hope that you will continue to work on that definition of close contact as being, again, within 6 feet for 15 minutes cumulative in a 24-hour period, because it could be that it's sort of easier in some ways just to say, well, the whole classroom is a close contact. And so we're going to do test and stay with, 30 kids, as opposed to maybe there really were, truly 5 close contacts. So, this is going to be a lot more manageable for you, for your staff, for your parents, right? Telling 30 parents that they've all got to stay out of, extracurricular activities that aren't school-based, that's going to be a burden for them, and maybe an unnecessary burden, right? Whereas saying your child was legitimately a close contact, we're going to help you keep your child in school, and there is a responsibility that you have to not have your child participate in after-school activities, but we've really narrowed it just to those students who really are legitimately close contacts. I think we'll just go a long way for you to be able to manage test and stay, as well as just, asking parents to take on that responsibility where it's most necessary.
Yeah, thank you so much, Rachel. If I can just add one very quick thing right there, there's just a finite amount of support that can be provided in terms of people swabbing kids throughout the state. And, you can imagine very easily a situation where if one school is testing an entire classroom for test and stay, that a school a couple of towns over won't be able to test their 5 actual close contacts. And so just please think about, the school over the county line or whatever it is as you make those decisions. Thanks.
One more question came up, Russell. If a student who refuses testing has a different diagnosis from a healthcare professional, can they return to in-person learning?
So refuses to test but has an alternative diagnosis. It's hard for us to answer that in every instance, but we did, I know that I personally took calls last year from superintendents where a student has a known kind of chronic vomiting issue or, a chronic cough. We just ask that you work closely with the student's medical provider to make that call. It's sort of hard for me, to make that call from my vantage point, but we would ask that it is possible to accept an alternative diagnosis, but we would ask that you do that closely with the family and the medical provider to know that it's the right call to make.
Yeah, that's right. Great. Russell, I think that concludes our questions. There were a lot of questions about specific details that are found in the protocols, and we will take all of these questions and update our FAQ and release a new set of questions in the coming week.
Yeah, thanks very much. I really appreciate everyone's time and support with this. We will continue to, offer these as well, and seeing what we can do to support you as we go. And we will post this as well, so anybody who couldn't get in, we'll make sure we get it recorded and posted as soon as we can to get this message out. Thanks so much. Have a great rest of the day.